Welcome to Prescription for Success with your host, Dr. Emil Haldey. Each week, we comb through the myths and facts about health and wellness in order to bring you the best advice and the right information that you need to live an incredible life. Now, here is Dr. Emil Haldey.
Hey, everyone. Welcome to Prescription for Success. This is your host, Emil Haldey. I'm super excited about today's show. As a reminder to our listeners, you can listen to us live on Voice America Health Channel, or go back anytime and listen to our previous episodes. We had some amazing guests and discussions, such as heavy metal toxicity. We had a show on pain management secrets, and also an amazing show with Dr. Furman on food as medicine. Please go back and listen to those episodes about tremendously life-saving information. Medicine is an art. It's also a science. And we can achieve tremendous results with modern medicine. But what's amazing is the placebo effect, such as doctors' warmth, sympathy, and understanding of a patient. They always outweigh surgeons' knives and pharmacists' drug. This is directly from the modern version of Hippocratic Oath, a pledge that doctors take. Today, we will talk about spirituality and medicine. Spirituality plays a tremendous role in healing. Today's guest is Dr. Veronica Anderson. Dr. Veronica is a medical doctor, homeopath, and a medical intuitive. She's a best-selling author. She holds a doctorate in pastoral sciences. Dr. Veronica is a national speaker, frequent guest on national TV and national radio programs on wellness, healing, and life enrichment. Dr. Veronica, welcome to the show.
Well, thank you, Dr. Emil. So happy to be here with you.
We're going to have a tremendous discussion. So tell us about yourself. How did you make it from a medical doctor to a medical intuitive? What is a medical intuitive?
Yes, well, it's interesting because now when I introduce myself, I proudly introduce myself as a licensed physician and practicing psychic. And it took me such a long time to get there. And when people look at me, they're like, what? Because they seem like, how can you do both those things? It seems doctor, psychic, what? It was a long journey. I started out as an eye surgeon. I was an ophthalmologist. I had my own practice. I was even a super subspecialist, a glaucoma subspecialist. Had my own practice. But along the way, you realize things about yourself and you think that they're normal and everybody's like that. And you realize one day that they're not normal and then you shut up about it. And that's like me having visions and knowing things that I had no explanation for. And I say that because there's information that I would know about people, about a lot of times disease states or what was going on with them in very intricate detail, but I didn't have the chart or the medical exam in front of me because it would just come to me. And I didn't want to tell anybody that. I certainly didn't want to tell my doctor colleagues that, so I kept quiet about it for so long. But I also assumed for a while that everybody was like this. Everybody could do these type of things, access the world of energy, because this is quantum physics and it's energy and we all can access it. I just realized I'm very talented with it. So finally, as I was shutting up, because I didn't want especially my doctor colleagues to know, when you don't tell your truth, stuff starts happening to your body. It really does. And so anybody who has an illness or an injury, it is a message from the universe that something needs to change. There's some purpose to it. I'm sure you would say, Dr. Emil, when you look at your heavy metal toxicity, that it wasn't simply about heavy metals. It might have been what got you to this point where you're like, I got to tell everybody about this, and it shaped your whole life. And
Yes.
So it was part of something that was going on. And most people, when I'd say, what do you think's making you sick? The ones that are really in tune do not mention something physical. They mention something emotional or something spiritual going on. So I ended up, after quitting ophthalmology, I walked away from a big practice. I had started from patient zero to double-digit thousands. I walked away one day in depression, compassion fatigue, PTSD, all these things that for me at that point didn't have a name. And part of it was I wasn't telling my truth about what I could do. And then a few years later, I had a big injury in my left knee. I went out running one day, tore all the ligaments, tripped and fell, tore all the ligaments, detached my tendon. And I had enlisted a spiritual advisor a couple weeks before this. And when he talked to me, I was in the hospital. He said, this is because you have all these intuitive gifts and you're not using them at all, and you refuse to use them. And so this is your inflexibility at using your gifts and talents to actually be part of your life and help people. Now, there were several other things that came together that made me finally say, hey, I have this skill, this gift, this talent that I actually can use to help people. And I'm going to figure out how to use my science side and this spiritual, energetic, quantum physics side, which still is science, together to be able to help my clients. And so I started helping health clients get transformation, feel better. And they would say, what just happened? What did we do? How do I feel better? How did you know the answer? Nobody else knew the answer. And you've never even been in the presence of a room with me. So I use this to help people in addition to all the hard stuff I've learned in medical school, plus holistic training and functional integrative medicine and homeopathy. Of course, I got certificates like every other doctor, got a bunch of letters. But on the other side, doctors and other practitioners started coming to me and say, one, how do you have the courage to do it? Two, how do you do it? Can you help me? My business sucks. My life sucks. I'm miserable. What do I do? So I started coaching and consulting with practitioners, because not just do I want to help clients, patients transform their health, we have to make sure that our doctors and our pharmacists and all the other people, nurses, everybody who is helping to heal, they feel happy and healthy too.
Heal the healers.
Sick doctors and sick nurses and sick pharmacists, which means it translates to sick people, and we're not able to help people get well when we're sick ourselves.
I agree. When did you start getting those visions and about seeing things about people?
Well, it's very interesting because, as I said, you have these parts about you that you just assume everybody else has. And I know they were there all my life. When I really acknowledged it, I started tapping back to say, when did this really start be, something that I knew I could tap into? And I can tell you, it became salient for me about 15 years ago, but I didn't talk about it until 2013, which is relatively new. So 6 years ago, it was very, very salient to me 15 years ago. But then when I started evaluating what am I doing and how I'm doing it, I start going back and realize even in medical school, when they couldn't, everybody just thought I was really smart. And yes, I graduated with honors, but I was a really great clinician in that I could get the answer when nobody else could get the answer. And I realized at that time that what I was doing is I was tapping into the energy space of the energy imprint of the patient's illness, getting the answer, and then using my logical brain of the stuff I studied to justify to all my doctor colleagues why it was what I said it was.
Wow. And it was very, very interesting. You touched on heavy metal toxicity. And I know I shared this with you previously. Maybe that's your talent already, sharing that with our listeners, because I do feel that it is now my mission to share with the world about heavy metal toxicity. And I believe millions of people are affected. And that's probably the reason why I got impacted by this condition, because it's not a very common condition. So I relate to your message. It's a very powerful message, because we get diseases or dis-ease of something in our body to convey a message. So that's very, very important. So,
yeah, and an interesting thing about heavy metal toxicity, although you say it's not very common, for somebody like me who has training in, functional medicine, integrative medicine, that area, it is something that is on the radar.
Yes.
And when I tap into people, I'll be like, have you ever been exposed to cadmium? That's coming to me, you know? So what'll happen is some of these answers will come to me and I think that what I tell people, who ideal person to come to you for help. Listen, I want you to go and max out on everything else before you come to somebody like me for help. Now, I can help you before you max out, but I want you to max out of all the stuff to get so that you're miserable enough. So when you come to me, you're willing to listen and take the guidance that I'm going to give, rather than say, okay, I got to go research it. You got to be miserable and have researched everything first. Like you, think about it. You're brilliant. You got your PharmD going on. I'm sure, tried to figure out yourself, everything that was going on. And when you couldn't figure it out, you finally, pulled your way to finally got to a practitioner that says, oh, this is easy. It's classic heavy metal toxicity.
Yeah.
It's classic, right?
Yes.
Because that was what they know. But you had to go through your own spiritual journey to believe that that's what the answer was.
But you know what's interesting? I had to really understand my mission and my spiritual journey, as you put it. What is that supposed to teach me? At the point when I understood that it is supposed to teach me that I need to use my voice to communicate the message to the world about heavy metal toxicity, that's when I started getting better. And it's truly amazing because it was a pivotal point that I will definitely remember for the rest of my life. And just to clarify something, Dr. Veronica, the condition of heavy metal toxicity is very common, but uncommonly diagnosed. It's an undiagnosed epidemic, and you and I both know how many people are impacted in today's toxic world, but it's very unfortunate that people go from doctor to doctor, and it could be cadmium, it could be mercury, it could be other heavy metals, but it's very, very prevalent.
It really is, especially since a lot of us have had major dental work and have a lot of mercury in our mouth.
Yes.
But one other thing, just a little education, and you've probably done this before, in the area that we live in the Northeast, there's a lot of mercury in the atmosphere. Mm-hmm. So we're being exposed. You might say, well, I've never had any fillings. It can't be mercury in me. Oh, yes, it can, because it's in the atmosphere and you cannot get away from it. So a lot of people have conditions that they can't figure out how they got. And one of the reasons that they got the condition was because the universe was giving them a message. Think about it. I'm not toxic with heavy metal, even though mercury's raining down on me all the time, because it's not just my genetics or anything. It just wasn't how I was supposed to bring forth my message.
Yeah.
Right? It wasn't part of my spiritual journey that it needed to hit me in a certain way. So there are people who walk around being like, mercury's going to kill everybody. EMFs are going to kill everybody. Pesticides are going to kill everybody. All right, I agree that those things are toxins, but we're all going to handle them differently based on our genetics, where we are, how we eat, what our lifestyle is like, but also what is our spiritual journey and the message we're supposed to get from a particular illness or injury.
Yeah, I love the discussion because normally you would have this discussion with a spiritual leader, right? And not everyone would follow it. But what's beautiful about this particular conversation, that you're a medical doctor. This is as scientific as it gets. And you have both sides. You have a very spiritual side to you and a very, very medical and scientific side, which is extremely powerful. So what's the link between spirituality and medicine?
So everything. Let's put it in everyday terms. We all have stress, emotional stress. Like there's 3 types of stress. There's chemical. We were just talking about, heavy metal toxicity gets chemical. We have physical. Let's say you have an injury or you're a football player or a soccer player or something. There's physical stress. You go to the gym. That's a physical stress. And then there's the emotional stress. So when people think stress, they think emotional. I'm under a lot of stress. My boss is a jerk. I don't have enough time. I don't have enough money. My kids are acting up. All those things. My kids aren't calling me. My mother was a crappy mother. My father wasn't there. We think about all those types of stress and emotions. And those are spiritual journeys for us when we have those type of stresses. And what happens is those stresses, and you already know this, correlate with what happens in the body, in our cortisol system. So if we can't process something that's a spiritual challenge for us, it's going to go and sit in our body in an emotion of fear, anger, or sadness, which will trigger our cortisol system. And that triggers all kinds of things happening in the body. We now know. And so that was a physical scientific explanation as to why what's going on in the universe really does matter. And everybody knows that stress hurts the body. It hurts your immune system. There's just so many, there's probably millions now of papers or in the literature that make this correlation. Mm-hmm. And I feel like my role is not to just talk about the science, but to help people do something about it, which is why it was on me to say, hey, I have this skill and talent and I can actually help people with it. So rather than just being woo-woo about it, it's just like I have come up with ways to actually help people process. It's not psychotherapy or anything like that. There are other ways to help people process these emotions and take them through the journey while I'm supporting their physical side. And so let's say I get somebody like you who comes in with heavy metal and they seem incredibly complicated. What's usually complicated is what's going on in the spiritual and emotional realm. And what I want to do is, okay, I'm going to work with your heavy metal toxicity, but if I work on your spiritual and emotional realm or help you, guide you to process it, all of a sudden, all that stuff goes away, right? It's
and
just
how
like,
quick is that? How quick is that work, the spiritual work?
it depends on the person. Some people, it can be almost instantaneous when you start pointing out these things. I've had people who, just one client, I just always think about her. She decided she was going to work with me. She, sent me in the forms, paid the fee, and I sent her back a video and told her my intention for you is this, that, and the other thing. I made a video. I sent it to her. She sent back to me an email and said, I don't know exactly what you did, but I feel better already. And I hadn't met her yet. Okay. So, and then when we started working together, of course, she ends up just had something everybody thought was really complicated. It was mold. It was, histamines. It was all this complicated stuff we hear about now, except she wasn't getting better from any of the treatments anybody was doing, to having worked with her for about 10, 12 weeks and her getting completely better. I mean, to the point where I said, well, maybe we need some supplements, this, that, another thing. I ordered a package for her because, it's not the first thing I go to. By the time she got the package, she's like, I don't need this. And she sent it all back to me. I was like, here's all your money back. Here's, we didn't need labs. We didn't need, because we were able to work through it so that her body released those illnesses. And people think, oh, well, that's crazy. But when you hear about miracle cures, and everybody's heard about them, the body can heal itself, but what you have to do is do something for the body to heal. And a lot of times it's not you may, like I said, you support the physical, you want people eating right and exercising and supplements. I want to talk about like food is medicine too. We got to talk about that for one reason. Okay. But supplements, you got to support the physical side, but if you do not work through and process your emotional pains, you will not let go of whatever the physical problems are. And you will escalate the physical problems. Your body, your spirit will escalate those problems until you really pay attention.
Wow. Very, very powerful. Let's talk about food as medicine. Let's come back to that. What are your thoughts on that?
So one thing about, food is medicine, and I agree that we all need to eat as well as we possibly can. Unprocessed whole foods without all the chemicals and all the stuff. Everybody's heard this ad nauseum. But one of the things that we do need to take into account with that is that we are all from different places. And the food that we have adopted to with our bodies may be different from a long genetic line. So for instance, if you are familiar with things like the blue zones, you know that there's some populations that they study way back, for instance, who are from Africa, where you say, okay, you listen to certain doctors, they're like plant-based diet. Well, my genetics are from a place where people were existing on meat, milk, and blood, not a plant-based diet. That's not what they were eating, right? And so we have to realize that the same exact, like plant-based is the way to go all the time. Yes, plants are good. We need the phytonutrients. But somebody like me genetically, and I've had my genetics tested, so I know this, I need more vitamin B12, more vitamin D. It's going to be virtually impossible. I need red meat. I need a source of vitamin D. Here I am. I'm outside of a place where I'm going to get a lot of sun. So anybody you see that's dark skinned, they're probably not going to be able to get some of this stuff on just a plant-based diet. They're not necessarily genetically set aside for that to work for them. So they will likely need supplements. Now, we all know that back from the 1930s, there was a study that showed that 75% of adults were not getting the recommended daily allowance of vitamins and nutrients they needed. We know that for years, almost 100 years now. it's worse now because the food is depleted. And if you think about the lives that we live every day, we're busy and we don't eat perfect 3 meals a day every day. Nobody does. And so to think that you're going to do it 100% only with diet for most people is not necessarily how it's going to go. And we need to confront that reality. Now, if you're a person that you're pretty stable and like that. Now, on the other side, as I said, you know, their studies tend to be done on certain groups of people and not others. I'm in a demographic. There's not a lot of studies on me and what's going to work for my body specifically. And so to say, hey, that's the best diet, and the study has been done on, you know, men from Ireland, is not going to be from my roots are 89% sub-Saharan African. I've had my genetics tested, as I say. It's not the same thing that's going to work for us. Now, things that are true for everybody, processed food is bad for everybody. Sugar is bad for everybody. But after you pass that, you have to really figure out what's going to be right for you. And there needs to be wiggle room in it. So, you know, whole food is great. You have to just realize, like, listen, I'm going to need to be eating meat. I'm going to need to figure out how I'm going to get my vitamin D and the amount that I need, because I'm dark skinned, even when it's summer in the sun and I'm out a lot of times, like I am this side of year, I probably are not going to get enough vitamin D in my body from food or being out in the sun. It's not going to get up unless I supplement. And most people need to realize that there's likely some things like that in their genetic code that mean that food may not do the whole trick. I have found in people that when I correct vitamin and mineral deficiencies, which means you take a good supplement that's high quality, and you know what I mean by high quality. I only like NSF certified stuff that's tested. When I make people do that, all of a sudden, a lot of the stuff that they had goes away if you just replete nutrients. So yes, number one, get them eating well, get the good things in their diet and the junk out of it and the processed stuff, and get all the stuff as much as possible out of your environment that could be toxic. But guess what? I can't do anything about the mercury in the atmosphere, right? So you have to just contend with, you can live the cleanest life you want, but we still know that mom's eating all organic and doing everything right. We're still finding toxins in their breast milk, even though they're not doing it. So we have to be just realistic about what's going on. And if somebody can eat their way to health and totally that works for them without doing any supplementation, it doesn't mean that that's going to be true for somebody else, because their body metabolizes differently. And so we can't make hard and fast rules. We just can't.
Yeah, so know your body. The message that you're trying to send out to our listeners is that know your body. Not every diet fits every lifestyle and every person. So you have to work with your practitioner, learn about the options, but they're key universal truths, right? As you mentioned, food that should not be processed or unprocessed food, sugar, it's bad for you. We know those. Eating vegetables and fruits, very, very important. And then work with your practitioner and understand your body and see what's happening to your body as you go through different modifications.
Yes, and one of the things, I don't know if you had a show about this, I think you might have mentioned, or I talked about it before, about pain. Mm-hmm. One of the big ways to know that something's not right, if you have any level of pain, something's not right. You know what I'm saying? So a lot of people think as they get older, it's just normal to be achy and painy and arthritis-y and all these other type of things. And, you know, like I'll know how well I'm doing if I'm eating okay and all this other type of stuff, or if I had something I shouldn't have had or too much, because I'll get aches and pains from it. So one of the common symptoms of you're not eating the way it's right for you, or you're nutritionally depleted, is pain in any way.
Yes, yes. So lots of people are following their doctor's advice, but they're not getting better. So what's being missed?
Well, there was a study shown that one of the highest areas of need is that spiritual and emotional area. And we know, and we've seen, especially as of those of us in holistic fields, that when we do all the other stuff right and the person's still not better, we always have to look at what's going on the stress side and deal with that in some way. So that is the big key that's being missed in studies of patients coming in and out of hospitals. They say, what do you feel like you need more of? And it's that is spiritual and emotional. People want to know, why am I here? What's my purpose? Why am I sick? And for doctors and nurses, what's happening is you are the first person seeing somebody a lot of times with their spiritual crisis that's able to do something to intervene. And so it behooves us to think about asking the question and not assume that people are crazy. Some people may benefit from a psychologist or psychotherapy, and some people need psychopharmacology and all those type of things. But other people, they're having a problem because they're under incredible stress, and that's being overlooked too much.
Yes. So you are currently working on a new book. Can you tell us a little more about it?
Okay, you know what? I know the break is coming up. Maybe we need to talk about that after the break. I have a new book that's for practitioners, and I want to talk about why it's so important that we look at doctors and nurses and help them heal and have a process for helping them heal. But just having people acknowledge and realize that their practitioners are struggling is going to be a big deal. So can we talk more about that after the break?
Tell us, of course, we'll touch on that as well. Tell us a little more, just give us a teaser before the break, because this is, I know the work that you're doing is super important. We'll touch on that after the break as well.
So the teaser is, the book is called I'm Miserable in Medicine, Now What? The Overscheduled Doctor's Guide to Taking Control, Getting More Happiness, Meaning, and More Money. And people are like, oh my God, doctor get more money? Yes. When people are having financial struggles, and doctors do with a lot of debt, we need to figure out how to resolve that so they're thinking about you instead of thinking about that they can't pay their bills.
Yes. Wow. So we are having a great time talking about spirituality and medicine, and the real cause of disease comes from spiritual sources. That's what we discussed earlier. So very, very important topic. We'll have even a better discussion after we come back from the break. But for now, I want to tell our listeners that to reach Dr. Veronica, you could reach her through her website, drveronica.com. To learn more about Haldey Pharmaceuticals, to sign up for a consultation with us, you could check us out on our website at hcompound.com or email us at wellness@hcompound.com. We'll be right back after these messages.
You're listening to Prescription for Success. If you'd like to reach the program today, please call 1-866-472-5792. That's 1-866-472-5792. You may also send an email to wellness@hcompound.com. Now back to Prescription for Success.
Welcome back to Prescription for Success. This is your host, Emil Haldey. Today, I have a very special guest with me, Dr. Veronica Anderson, a medical doctor, homeopath, and a medical intuitive. To reach Dr. Veronica, you could reach her at her website, drveronica.com. To learn more about Haldey Pharmaceutical or to sign up for a consultation with us, you could check us out at hcompound.com or email us at wellness@hcompound.com. Dr. Veronica, so we are having a phenomenal discussion. By the way, if you're a listener and you're just tuning in, make sure you go back and listen to the full episode. We're having a tremendous discussion here, a lot of life-changing information. Tell your family and friends to tune in and to listen to this either live or download the podcasted version. So earlier in the first section of this episode, we talked about the connection between spirituality and medicine. And you told us that the source of disease, a lot of times, or most of the time, or every time, is the spiritual part, right? There is a reason why we're getting that disease or that discomfort in our body. The universe is trying to teach us a lesson. And that was very, very powerful. You also started telling us about your new book that you're working on that's coming out very soon. Can you tell us a little more?
Yes, it's in pre-order. It's available on Amazon already for it. And I would tell people, order it and get it and give it to your doctor. If you are a doctor and you're listening, you want to read this. It's called I'm Miserable in Medicine, Now What? The Overscheduled Doctor's Guide to taking control, getting more happiness, meaning, and more money. And I wrote it that way because I'm telling you what's going through your doctor's head. They're miserable. They'll talk about the frustrations of medicine or everything, but there's people who are just utterly miserable. They're overscheduled, they're burnt out, and they can't take it anymore. And so they're walking around like zombies. They're sick themselves. They're cynical and skeptical, which is a sign of burnout. And so if you think your doctor doesn't care, it's because a lot of them are burnt out. The suicide rate for female physicians is 4 times higher than the normal population. Of 4 times higher than suicides from other women. The PTSD rate, post-traumatic stress disorder, is equal to and more than what we see in veterans, in doctors. Now, I talk about this because I've had burnout, I've had depression, clinical, severe, I've had compassion fatigue, and I've had PTSD. Now, I'm happy to say had, okay? Mm-hmm. And come through it because I needed to tell this story, and probably part of my journey was to lead in this particular area. And I wrote this book because doctors are sick. Other healthcare practitioners are sick themselves. Even if they may not seem physically sick, a lot of them are. And they're spiritually and emotionally sick and unhappy. And just taking care of people day to day. And let me just say, if you have a doctor that's helping you, you know how happy the doctor would be if you just say, thank you. I appreciate what you do. I mean, it's just we feel unappreciated. We feel like, you're a cog in the wheel. The system, your patients think you're their servant these days because everybody's a patient advocate. Everybody has their PhD from WebMD. And so people don't even like taking care of people anymore because it's an argument all the time. It's a lot of demand. And I have 7 minutes to see you. And if I don't see you in 7 minutes, the people up there who pay me are going to be pissed at me. Okay. And so there's this double bind with the doctors and other practitioners in between that a lot of times patients aren't seeing and understanding why doctors feel the way they do. Now, when I put on the end of that more money, everybody wants to make more money, even though they don't want to admit it. And I'm not just talking about doctors. I mean, you look at the guy at Sloan Kettering who was not disclosing that he was getting millions of dollars, but everybody wants to get what the guy at Sloan Kettering got, the doctor there, because we all want to have a better life. And when you work hard, this is what you expect as your reward. But on the other side, money is energy. And what's happening, let's talk about energy. This is where we get a little more to the woo-woo. Doctors have given a lot of their energy away without getting it in return. And so you go to school. When I was an intern, I worked 100-hour weeks. And it was crazy. And a lot of us have done that. And we depleted ourselves then. We took out a lot of debt to go to school. And then we run around and help people. And you're depleted financially. And you get depleted also energetically and emotionally because you're giving. And you're not getting back at all. And so this is what's burning out doctors. And in addition, people have to understand that in order to get results, you have to make some type of energetic exchange. So doctors are giving and they're not getting any energy back. And patients aren't giving the energy back. Money is energy. And so a lot of people say, well, why aren't I getting well? Why don't I have a good doctor? Because you haven't made the energetic exchange. Your employer paying your insurance premium is not you making an energetic exchange with the universe. Because so when you're picking a practitioner, you actually pay your practitioner. It's you signaling to the universe that it's important enough for you to spend your hard-earned money on it. And you really want it as much as you want your smartphone. So people walk around with $1,000 phones regularly and pay that bill every month. And yet they feel offended to pay a practitioner that has went to school. I mean, I calculated when I finished, I had, I don't know, let me see. I think I had 11 years post-college of training. And then all the CME, we all go through for training. And for people to feel like they should, that it's just should be free, and my family shouldn't eat, I shouldn't have a nice house, I shouldn't be able to go on vacation because we should just give it, that's what's depleting doctors energetically. And I'm not saying that some don't make it, but when people come and work with me, I make them decide that they want to make an energetic exchange. I give them the opportunity to show the universe that they really care about it. All right. And I think that's something that people are, somebody's listened to this. You got mad when I said that. You're exactly the person that this message was for, right? Some people are there, they're going to be shaking their head. I never thought about it that way. It's true. You want food, you go to the grocery store and you pay for it. You want gas in your car, you go to the gas station and pay for it. You go to the doctor, you expect health, but you're not willing to pay for it. So you are showing the universe what you think is important by how you spend your money.
You're sharing what the sentiment is with a lot of doctors, and I have a lot of private conversations with doctors, and many doctors feel that way. They're depleted, they're burned out, they are mostly good, caring, compassionate individuals, but it's also the system that's depleted. It's not designed for success. So I want to say that most doctors that I know are very passionate, compassionate. They went into medicine to do the right thing. And they're really trying hard, but they are constantly being drained by the system rushing them through the process. 7-minute appointments, and 7 minutes not fast enough anymore. It has to be 6 and 5, and that it's a depleted system. But how does the practitioner, a doctor who's seeing patients regularly, combine spirituality and medicine? What's your advice to the doctor?
So the first thing is they have to admit that they need help themselves and go start down their own spiritual journey and come up with a system and a protocol for themselves. And once they learn how to shift, then they're going to be better able to help their clients. So my book is walking practitioners through how to make a shift in their life, how to get the clarity, how to figure out, should I quit medicine? Should I stay in it? If I stay, how can I make it work for me so that I can give what I want to give and feel better? And if I decide to go, what can I do with all this education and training and gifts and talent? So it's about once going through your own spiritual journey. But then when that happens, you figure out what you specifically are set aside for. Right. So I went through my own spiritual journey to realize who I can help. All right. So now my dog's like in the background. I'm going to bark.
You have a little co-host there.
I have my co-host. Whenever you're doing something like this, something always happens. Like you're talking about your phone ringing. So everybody out there, that's that's my kids, my 2-year-old. Every time something happens. So,
it's okay. Doctors live real lives. We love pets. And we actually compound medicines for pets. It's totally normal, healthy part of life.
Yes. Well, I'll say one thing about pets is that a lot of times I've noticed I can tell the state of health, emotionally and physical, with people based on how their pets are doing too. It's very interesting. We are spiritually connected to our pets. And so one thing is I'm spiritually, my doggies that you're hearing, I actually figured out, and if you don't believe this stuff, just, ignore it, that they were in past lives with me. I remember a life that was 4,500 BC where my dogs were peacocks in my past life. And now they're with me as 2 loud, wild dogs. So, I mean, just these type of discussions that I have with my clients, like I'll have with my clients discussions about why they go to the organic holistic dog food store, but they won't do it for themselves. Right?
Yes.
So I'm like, oh, okay, but you're doing all this. When do you do this for yourself exactly? And, these are conversations that doctors in traditional settings, when I say traditional Western American healthcare system, don't have the time to even ask these questions. So part of how I work with people is being in an environment where we have time that I can tap into and ask the right question, which will help lead them and guide them so that they're able to go along their spiritual journey. And so that's the same when I work with people who come to me with kind of weird stuff. but also practitioners to be able to ask the right questions. So I've become a good question asker because I'm reading your energy as we're going, and I'm figuring out, well, what is the right question that is for this person? And I'm not always thinking, what is the right question? I'm not, it's a little more smooth than that. But, this is not something I looked up in PubMed and said, okay, I got to do it like this because this is a study about it. And the other part is for doctors to get comfortable enough to understand that, okay, we have pharmacology and all the type of stuff which gets studied, but these areas in the spiritual realm, nobody's going to get really rich from it. And so it doesn't get studied in the same way. So we have to be willing to use it, even though it's not in the research journals. And as I said, okay, I want to address, there is a role for pharmacy, pharmacology, all that. And the important part about it is, and we touched on the differences in diets. I know you have your compounding pharmacy. I always make the point in those studies, well, they didn't study that drug on a lot of people like me with my genetics. And so how do you know that's the right dose or the right thing for me specifically? Everything needs to be customized. So the important piece is to have a doctor who understands that and asks the right questions to be able to decide, okay, is the standard stuff off the shelf going to work for them, or do we need to do something special for them? And it also takes a doctor who, they don't do knee-jerk that they're going to compound everything. And why do I say that? I say that because I meet a lot of practitioners, and let me just tell you an area that's just very big on this. Bioidentical hormone replacement therapy, everybody's doing that now and compounding it, and I'm not saying it shouldn't be, but I look at some of these doctors where that's their whole practice, and they've tethered people to them for the rest of their lives with these hormones. And first of all, if you look around the world and realize that we don't all need hormones to get through life. So there must be something else going on. Let's figure out what's going on. And we may need to use hormones as like a stopgap measure to get you back on track. But how do we get you back on track so that you can feel good and make your transitions in life without having to use it your entire life? I think it should be like that with all medicines. You were not born with a Lipitor deficiency. I'm mentioning that you weren't born with a deficiency
metformin deficiency.
You were not born with a metformin deficiency. And now, interesting thing about drugs like metformin, there are actually herbals that work better than metformin that will probably integrate with your body better. All right.
Yes.
And that's the kind of things I work with people with, because what pharmacologists actually realize is that the natural stuff from the plant, probably what the pharmacy companies do is they take it out so they can sell it for a lot, but there may be something natural that works better that you can use.
Yeah. So Dr. Veronica, what are some of the conditions that have emotional roots?
Oh my God, cancer.
And spiritual roots.
Big one, cancer. I have a colleague, oncologist, who commonly talks about, he's noticed in all his cancer patients that they go through, all the cancer patients have at one point, and they have to contend with this, had some kind of death wish. And they have to confront, where was that death wish? It might not be currently. Where is the death wish, and what do we do about it? And this is like an oncologist who, he's like, listen, yeah, I know people are going to need chemo and radiation and all that, but if they don't deal with their crisis in that area, that is one of the things. Let's talk about something like breast cancer. A lot of women who have breast cancer, especially in the left breast, have a lot of problem with loving and nurturing themselves. Thyroid disease, Hashimoto's especially. The itis is a lot of times, think about Hashimoto's. First of all, you're attacking yourself because it's an autoimmune disease. It's inflammation, so you're angry, and it's in your throat where you're not voicing what your truths are. So you're angry, not voicing your truths. And when you start doing that, yeah, you're going to need some physical stuff done. But there are people who completely heal from these type of things, right? Here's another one that's very, very common, and this is well documented in the literature for anybody who wants to look at that. ACEs, adverse childhood events, traumas, very highly associated with autoimmune diseases. So if you see somebody has an autoimmune disease, and what are some of the common ones? Lupus, rheumatoid arthritis, those are some of the like really common ones. Actually, Hashimoto's is a autoimmune disease. A lot of people who've had that have had some type of traumatic event in their childhood. I mean, these are associations that are in the literature. And I'm not talking, usually I'm not talking a physical trauma. I'm talking some kind of big emotional trauma that's going on. Abuse is very common. So we need to start realizing that if we don't deal with the cause of the cause, I can give you all the drugs that I want to, and you're not going to get better. You can eat the best diet in the world, take the best supplements in the world. You're not going to get better until you learn how to process whatever that event was.
So can a psychologist or psychiatrist help?
I think there's a role in it, but we're not talking about the laying on the couch and going over and over again. I'll tell you what has helped a lot of people that's quite interesting. I just talked about my dogs in a past life. Past life regression therapy. If you never heard of it, Dr. Brian Weiss is the famous guy for it, who's a psychiatrist who became, spiritual guru. And I've noticed that, okay, I can see things in my past lives. I'll meet patients. I can see things in their past lives. So a lot of times when people are able to see something in a past life, they end up working out their physical problems. And their physical problems, these are people who things go poof and they go away because they realize, oh my God, I was a soldier and they put me in the guillotine and my neck was cut off. Oh, that's interesting. Okay, I know that's not now. Neck pain goes, figure out what it was that was going on. So these are the type of things that are bizarre and weird according to people that I think that Western doctors just need to know that there's somebody else who may be able to help outside of the realm. So you're saying, I don't do all this stuff with people. I know it's available, like I know acupuncture is available, like I know Ayurvedic medicine is available. So when somebody comes, let's say you have pain, I can say, ooh, what would you consider acupuncture? You see what I'm saying? Yeah. So it's not about doing it all yourself. It's about knowing and think about, I'm talking about acupuncture and let's say traditional Chinese medicine. They talk about the qi, they talk about the spiritual, they talk about blockages in the channel, they talk about releasing emotional stuff. And that's something that acupuncture can do. So it's not simply, oh, you have pain and let's like tap a needle there. It's figuring out, oh, well, you have pain there. This is associated with this kind of problem in the liver with fear, or in the kidney with the liver's anger, and in the kidney with fear. And so we're going to put a needle over there because that's going to help release the anger from your, liver. You know what I'm saying? It's not as simple as, hey, let's just throw this pill at you.
Yes. So what is your co-host's name? Your dog's name?
My co-host. Oh my God. Okay, and you know what? That's Artemis and Apollo. And I want to go, shut up. As soon as we stop talking, they will be quiet.
It's okay. We have two wonderful, wonderful guests here, right?
Yes.
Dr. Veronica and some other guests. So in your work, you talk about 5 pieces that have to be in place for physical side to get well. What are those 5 pieces?
Okay, so let's just break it down. Most people only have 40% of the equation, and you need the other pieces. So one is, of course, nutrition, how you're eating, diet. Second, fitness, some form of exercise. But then you have your hormones, you have your neurotransmitters, things that are going in the brain, and you also have digestion and detox. So those are 5 areas that play into the physical that you have to get all in balance. So it starts with diet and exercise, but then you look on modifying your neurotransmitters, your hormones, and your digestive process and detoxification using that. Now, everybody says everything starts in the gut. Everything does start in the gut. If you think you have a gut feeling about something, well, yes, you do, because now we know, of course, that most of the neurotransmitters that make us happy or sad, 90% or more are produced in the digestive tract. So it's important that when I say here are the 5 things, and people who know anything about that will say, yeah, she's absolutely right. You have to get all those 5 things in balance: diet, fitness, exercise, neurotransmitters, hormones, and then digestion and detox, all in order to be well from the physical side.
Yes.
Now, if you get those all in order and you're still not doing well, that's really saying that something's out of balance with your stress and your emotional state.
And you got to look for some spiritual reasons.
Yes. Now,
Wow.
let me tell you what's common with people. There are common with people that you're either all physical or you're all spiritual, right? So there's some people who will do all the spiritual work and they're physically a mess.
Yes.
And then you have some people that they'll do all the physical stuff, but they won't deal with that side.
So, Dr. Veronica, great discussion with you and your co-hosts. What's your 15-second message to our listeners? We are coming to an end of our show. What's your takeaway message? 15 seconds.
My 15-second message is you really have to just pay attention to it all. You are mind, body, spirit. And you have to realize that spirit really is where it all starts. It starts outside first, and then it manifests in the body. And so you have to, this is your life's journey. Your illnesses, your injuries, your traumas, your dramas are a message from the universe of what you need to get done in your life. And so when you go to your practitioner, you need to be discussing all of it, not just the physical aspects.
A very powerful message. Dr. Veronica, thank you so much for joining us. Thank you to you. Thank you for your co-hosts. To reach Dr. Veronica, check out her website, drveronica.com. To learn more about Haldey Pharmaceutical or to sign up for a consultation, check us out at hcompound.com, or you could email us at wellness@hcompound.com. Ladies and gentlemen, thank you so much for listening. This makes it a show. If you want to live a happier, fuller, healthier, and a more fulfilled life, you need to be the CEO of your health. You need to be guided by an amazing practitioner, but it's your life. You lead it. Thank you for joining us. Until next time, be happy and healthy.